A lot of people ask themselves this question: could I
Could
be
I be
pregnant?
pregnant?
My breasts are full. I'm getting tired. I'm feeling as if I'm going to vomit. Is it pregnancy? What is this? Now, if you're one of them, it might be the reason why the algorithm has sent this video to your timeline. You're welcome in. Let's talk about 10 signs of pregnancy that you can never miss. And if you're having any of these signs, you should better go and test and get your good news. One thing people do not know: a lot of people are trying to conceive. A lot of women are trying to conceive, trying different methods just to see which one will work. And then when they have the symptoms, they start saying, is it PMS? Is it premenstrual syndrome? Is my period coming? All of this uncertainty. That is why I've decided to bring you these 10 signs. And if you're having them, do not even worry. Just go and do your test. Come back under the comment section of this video and let me know. If you're new to my channel, my name is Sandra. Yes, I've been out for a while, but now we are back with full force because there are a lot of women. The number of infertility cases in the world is alarming. Even though there are recent um, technological advancement in conceiving, trying to conceive, in the diagnosis of fertility and all of that, people are still very, very actively trying to conceive. So that is why I'm coming back fully on this channel, and we are going to be talking about everything woman, everything fertility, pregnancy, and all the likes of it. So if this is something you're looking for, if you're trying out to conceive, if you're a woman who just wants to look after yourself, if you're a lady who just want to connect, then this page is for you. Make sure you hit the follow button, like and share this video. Let's dive quickly into the video. One of the earliest signs of pregnancy is implantation bleeding. You know that tiny pinkish blood that you see about 6 to 12 days after you have ovulated. Remember, everybody ovulates on their own day according to their cycle length. If you do not know how to calculate your ovulation day, go through the channel. I have a video on that. So, you know the signs of ovulation. If you do not, we'll be talking about that in another video. But 6 to 12 days after your ovulation, if you start seeing like a pinkish blood coming out from you, it could be implantation bleeding. Now, what is implantation bleeding? When the fertilized egg attaches itself to the lining of your uterus, that is implantation. The fertilized egg has moved from the ovary through the fallopian tube and has settled in the lining of the uterus. That is implantation. When that process is going on, because of the way it is implanting into the uterus, then it sheds a little blood, and that is what you see. But that blood is not as darkish as the one you see in your period. It is light pink in color, and it lasts just for a few hours to maybe 1 or 2 days. But one thing you should know is that not every woman experiences implantation bleeding, and not every pregnancy would you experience this. For me, I experienced it in my first pregnancy, but in my other two pregnancies, I did not experience any implantation bleeding. So it is different for each woman, and it is different for each pregnancy. Along with implantation bleeding, some other women experience what we call mild cramps. So this is also as a result of the a fertilized egg implanting. So you know when something is implanting into something. So some women experience little cramps from it. It is not like the cramps you get when you're having your proper period. It is different. That is why some women confuse some of these signs as if it is PMS. It is not actually PMS. It is the fertilized egg that is implanting into your uterus. Another sign that most women will have if they are pregnant is breast changes. Now, I know this is common even in people who are not pregnant when their period is coming, but because of hormonal changes when you're pregnant, one of the parts of your body that reacts quickly to it is the breast. The breast becomes fuller, becomes heavier. Women start to feel as if the breast is swollen, or it feels like it's tingling, or it feels as if it's sore. You know how I don't know. Well, I'm saying it because I've experienced it. Um, I don't know how I would explain this properly for you. Your breast feels fuller. Your breast feels as if it's sore, as if it's bigger than it used to be, and it's a bit, tingly. Sometimes you can see that the darkish side of your breast, which is the nipple, is becoming more darker. Then that could be a sign of pregnancy. So if you're having that right now, and it is between 6 to 12 days after your ovulation, go and do a test. If you're trying not to conceive, and it's about 6 to 12 days after your ovulation, and you're feeling tired, you're feeling really exhausted, tired, sleepy, then you could be pregnant. This is as a result of hormonal changes, and the hormone responsible for this is progesterone. Now, during the early stages of pregnancy, the body is already preparing itself behind the scene to cater for this embryo that will develop and become um, a baby for you. So that is why your body produces progesterone rapidly. And when you have this hormone in your body, one of the effect of it is feeling tired, sleepy, and all of that. So if you're having that symptoms, along with the one we have mentioned before, you could be pregnant. So please go and test. Along with the other symptoms we have just mentioned, you find yourself going to the loo more often than usual. This symptom often becomes really stronger as your pregnancy develops, especially when your growing baby starts to press on your bladder, making you feel the need to urinate more often. But there are some women who, at the early stages of pregnancy, start to feel the need to urinate more often, and it is not unusual. The reason is because of pregnancy hormones. Pregnancy hormones changes a lot of things, I tell you. Another sign that you could have that could mean that you're pregnant is having the urge to vomit or be sick. Although this sign is mostly seen in later pregnancy, but some people experience it even in early pregnancy. Some people experience this symptom even in early pregnancy. So, if your period is a bit late, you're having all of these symptoms I've spoken about, and you're having that feeling of being nauseous and a feeling of as if you want to vomit or you start vomiting, you could be pregnant. Go and take a test. Another very, very early symptom that you can feel. This one, most people feel it. They do not even know that it is what they are feeling. That feeling of fullness and bloating in your tummy. Most women feel this even before a missed period. Even before they start to suspect, oh, my period might be late. You are already having bloating, your abdomen is already full, and you are attributing it to a food you ate. It isn't. You could be pregnant. Now, the reason for most women having bloating during early pregnancy is as a result of hormonal changes. All of this we have been speaking about are all as a result of hormonal changes. Pregnancy hormones, if they have not changed your mood, then they have not started. Hormones in general, even as a lady going through your menstrual phase from ovulation period to um, ovulating to your period and all of that follicular phase, all of these phases in your menstrual phase. Do you know that your hormones make you behave in different ways across these phases? That is how pregnancy hormones also affect your moods. So, if you find out that you're having mood swings, you're happy, the next thing you're sad, the next thing you're elated, the next thing you don't even know what to feel, that is pregnancy hormone in the making, trying to alter your mood. Now, if you're having all of these mood swings with these other symptoms we have spoken about, then you could be pregnant. Why not go and take a test today? If you find that any tiny smell around you, you're starting to smell it, and this was not the case before, then you might be pregnant, because pregnancy hormones heighten your sense of smell. I tell you, you would have come across a pregnant woman before. When you rub a perfume, they say they don't like it. There's a food someone is cooking 10 miles away from here. They can smell it and they say that is what they want. That is pregnancy hormone doing its job. So if you find that your sense of smell has increased, then you could be pregnant. Coupled with other symptoms we have spoken about, you could be pregnant. So go and take a test today. Last and not the least is your ability to crave for different foods, different things. That is pregnancy hormone doing its job. It makes you crave for a whole lot of things. That food you have not eaten in 10 years, you start to crave for it. Even the food that you have never tasted before, you're craving for it. You're passing through the market, someone is cooking. You're passing through the restaurant, someone is making a dish, a recipe, and you're smelling it as if you're the one making it. It is pregnancy hormones that is affecting you. Yes. So, in summary, these are all the signs we have mentioned just here on the screen. If you see that you are experiencing any of this, coupled with the fact that you're not having a missed period, or even if you have not yet had a missed period, you're wondering, it could be pregnancy. Give it a few days, go and test. If you're already having a missed period, coupled with these signs, you are pregnant. You could be pregnant. Go and take a test. This is where I will end it today, but I will come up with another detailed video about the signs of ovulation for you to watch out for and things to help you improve your ability to ovulate, which in turn will help you increase your chances of getting pregnant. And if you watch this video to this part, please like, share, comment, and if you have not followed me, please follow, and I'll see you on the next one. Bye.